Dear audience, welcome to our new podcast. And tonight is going to be with one of our inspirational and amazing pediatric endocrinologists, Prof. Nandu Thalange. Good afternoon or good evening, Prof. Nandu.
Good afternoon. Very
Yeah,
nice to see you again, even if only virtually.
yeah,
Hopefully you'll be in Dubai sooner or later, and I'll get to shake you by the hand again.
yeah.
Always good to see.
Good to see you. Always
You do
good to see you.
amazing work with the Pediatric Endocrine Cafe, so that's what's made me enthused to do some of the things that I've done, and it's on your back,
Uh,
basically.
your contribution is amazing and it's very well received and welcomed by the whole group. Right. Recently we heard about the Homer calculator. Is that what you've named it?
Yes, I mean I've used Homer for a long time as a essentially a tool for quantifying insulin resistance. We talk about insulin resistance, um, as a cause of many of the health problems that stem typically from obesity. And unfortunately, here in UAE, and I guess it's the same in Oman and many of the countries around the whole of our region, that we're just seeing, increasing numbers of adolescents in particular, and even pre-adolescents with obesity. And so to at least have an objective measure of the insulin resistance is really useful. And you can, even a very simple treatment like metformin, you can actually see the difference it makes to the insulin resistance. And I've always found that somewhat motivating for my patients. I can show them that the treatment is actually potentially helping. Um, because if you stand on the scales, which is what most people are doing themselves, they're not going to see an improvement while they're in a growing child. The scales are going to keep going north. And I think it's very important to try and get some buy-in from the patient and the family as to why this is important. And so that then led me to ponder recently, well, I've never previously used the more advanced features of HOMA, the insulin output and insulin sensitivity, HOMA beta and HOMA S. And actually those tools are often very difficult to find. So I thought, well, with the power of AI, I could actually devise a calculator that included those things. I just find it tremendously insightful, because there's all the difference in the world in, for example, having a insulin output of 250% of basal insulin versus an insulin output of 75% basal insulin, which is potentially an indicator of impending diabetes. The same with sensitivity, how sensitive are you, how resistant are you? They're telling you different things about the patient. So I think that's useful.
Mm.
And I think you have also done some experimenting with the early versions of the calculator. So perhaps you can reflect on your
I found it very
experience in using
useful. I
them.
found it very useful. Yeah. So I tried it with my patients today and this morning. So I was showing, the dial up and the gauge meter to show the resistance. So that was more insightful. So rather than that, they're talking just kind of boring numbers or just given figures, but now they are seeing the changes that could happen and what does that mean to them, and that perhaps is going to motivate them to reduce these kind of figures that start appearing on the monitor. So how was the calculator evolved from the original Homer model to this latest version you are launching?
Yes, so it sort of grew like Topsy, really. So it occurred to me, I mean, in fact, you may have even mentioned to me that, not every place in our region has easy access to insulin measurement. So to have something that's more accessible as a measure of insulin resistance, I thought about the triglyceride glucose index, also known as the TIG index, TYG. And it's a very simple calculation. It's just derived from fasting glucose and fasting triglycerides. And and it's relatively accessible. I think most places will be able to at least do a fasting lipid panel and a fasting glucose, even if insulin is out of reach or out of affordability. So that I thought would give those people an objective measure of insulin resistance and metabolic syndrome. It's shown in adults to correlate very well with metabolic syndrome and risk actually of cardiovascular disease, and as is insulin resistance for that matter. And we know, for example, that insulin resistance is highly correlated with blood pressure. So, insulin resistance and hypertension go together like eggs and, I don't know, eggs and something. So it was a natural extension of the HOMA. And, having got, we're already then in metabolic syndrome territory. So it seemed logical to then, actually look at the metabolic syndrome definitions, and could we incorporate those definitions into the calculator. So you don't have to. So basically, there's a sort of minimum data set that you have to put in to get anything useful out. But beyond that, you can continue to put more and more and more information in. And I think the metabolic syndrome calculations are based on pretty standard things, waist circumference, blood pressure, BMI, and also lipid characteristics, so HDL and the triglycerides, which are already in the calculator. So it was an easy push then to develop the metabolic syndrome calculator. And rather than just have my own version, I obviously wanted to incorporate the internationally accepted definitions of metabolic syndrome. And there are two different models that are in the calculator. So both of them can be applied, and if you have a preference for one or the other, you can choose which one you want, but you'll get both.
Fantastic.
And then you've got most of the lipid panel there,
Yeah.
and the insulin resistance and the blood pressure and the waist circumference and the BMI. So what is more logical than to then move on to lipids, and actually include the full lipid panel.
It is fabulous to
Now,
have a comprehensive tool for all these kind of parameters in one place.
So I initially titled it the HOMA calculator, as you know, and but then it sort of evolved into this metabolic assessment, comprehensive metabolic assessment tool. So I think it's obviously much more than HOMA now. And then having got the lipids, one of the things that I think many, certainly in my experience anyway, and you may disagree, but I think many people find, even professionals, find the lipid panel a confusing bunch of numbers that don't necessarily make sense. Well, we actually have a much better number than the lipid metrics all individually, and which is to calculate something called apolipoprotein B, which you can do. There are calculations for this. And so the calculator also generates an estimated apolipoprotein B. So essentially every atherogenic lipid particle has an apolipoprotein B molecule on it. And so if you can estimate that, that's giving you a more direct measure of cardiovascular risk. And So I think it's a useful measure, and it's a single number. So you can actually take those confusing lipid panels going up and down, and you just boil it down to one number that's changing over time, hopefully in the right direction. But unfortunately, the natural history of the ApoB particles is that they rise progressively over time. So your risk is lowest in the at birth, and then you get a progressive rise throughout life until 50 to 60 years of age. And by the time you've accumulated enough cholesterol in your artery walls, then you're at high risk of a heart attack. And unfortunately, it's the commonest single reason worldwide for fatal outcomes of cardiovascular disease. So I think I read that in America, every 38 seconds, someone dies of an arteriosclerotic event, be that a stroke or a myocardial infarction or some other event. So, it's the thing that kills more people than anything else. And I think, we've now got really quite a comprehensive assessment going on here. You've got your basic physical parameters like height, weight, blood pressure, waist circumference, some lab analyses, HbA1c, lipids, etc. So how do you pull it all together? So I felt that the next, the final part really was to pull it together into a summary. And actually, it's intended for putting in the notes. So there's an EMR summary for electronic records, or you can actually physically print a PDF if you're still on a paper note system. And potentially, you could even give that to the patient if you want to, electronically or physically. But it also includes, and I think this is more useful, actionable insights. So what can you do about it? You found you're at this high risk. I think for example, just to pick a very simple example, one of the easiest things you can do to ameliorate insulin resistance is by going for a walk for 15 minutes after eating. So you have this brief window after eating when muscle can take up glucose without insulin-independent glucose uptake. So this is reducing the amount of work your pancreas has to do. And it's very simple. We're not saying, go and run marathons or, do physical jerks for 90 minutes. We're not doing anything difficult, just simple steps. And I think once people start to see how this helps their numbers, then maybe it will help keep them motivated. So how was it with your patients? Did you feel that they were motivated to change by seeing the numbers?
Definitely. We like the advice that it comes with the interpretation of the markers. So we went through that kind of together. So this is the interpretation of your markers from the investigation that we've done together. And then I had to explain a little bit more there. And then there was some kind of advice that you need to exercise, perhaps you need to change your lifestyle, you need to perhaps to do this and that. So we found that very useful. And then since we got all of these meters together, so now all of them in one page, and then we were able to print it out and actually print it as a PDF. And then I send it on WhatsApp to his contact. So now they got something digital that they received on his phone that's going to keep it for next perhaps visit. Now, we haven't discussed the new version of this tool because I believe this tool is not just be able to be integrated into clinical practice, but it's more of, or can be kind of personal health tracking as well.
Yes, I mean, it's, I think once you've got the basic information in there, then it's easy to just update that information over time.
Yeah.
And so I don't ask for any personal information other than the measurements and labs, except for the MRN, and that's only for tracking purposes. So you can go back and find the patient's previous episode if you wish. But you don't have to put the MRN, medical record number, in the chart, in the calculator. That's purely for the professional who's wanting to go back in time to see what it was last time, see how things have changed.
What's
Um,
your thought about sharing the calculator with the patients themselves so they can access it from home, for example, and then they can put the things in there when they get source, for example, the weight is changing or the waist
yeah.
circumference changing, and then put that on the calculator and see the changes there.
To be honest, I don't have any objection to it. It's nothing, there's nothing confidential in the calculator, as far as the patient is concerned. It's their information. I think they're entitled to it. So I don't feel they shouldn't have it. I think it's more that some of the language is not really, perhaps I should say, designed for patients
It's
in
for
as
healthcare
much as the language
professionals.
is somewhat technical. But I mean, that's easily overcomable. I could, if you wish, or if others wish, we could produce a plain language summary of the findings, to make it easier, and even potentially in other languages. So, obviously in
Um,
our region, Arabic is the obvious candidate language, but I'm aware we have colleagues in Morocco and Algeria who maybe would prefer French.
that's correct. Yeah.
Um, and we also have other members of Pediatric Endocrine Cafe, even in South America and the UK and Europe. So I think the other thing to say about this calculator is it's not specific to pediatrics. So although Pediatric Endocrine Cafe is a pediatric group, actually the calculator can be used for anyone, adults or adult or pediatric. And so one of the things that I recently added was a lifetime cardiovascular risk calculator. Because, having got all this information, you might as well know what your risk is. And I don't know how useful it is for a 14-year-old to know that their lifetime risk of heart disease is 83%. But maybe it does focus the mind a bit if it's a 55-year-old who finds their risk is 83%. And obviously there are patients who have horrible lipids. So we see a lot of horrible lipids in this part of the world. And maybe their risk is unexpectedly high. They have maybe a 20% risk of a cardiac event by 30, for example, which is not old age by any means. So I hope it will be a useful tool, and I certainly have found it useful. But for my own practice, I mean, that's what the original motivation was, and I hope others will find it useful. And I'm happy to take suggestions for improving it or making it better, or maybe making it less complicated. So there are some, really advanced features in the calculator, which perhaps very few people will use, and maybe they're not needed. But if you've got sick fat cells, then it's reflected in your adipokines. You'll see classically in the child with or adult with severe metabolic syndrome, you're going to see high leptin. They become leptin resistant, and you'll see that the adiponectin, the sort of another adipokine, other adipocyte hormone, is dropping very low. So one of the ways we can assess metabolic syndrome is actually the leptin and adiponectin ratio. So that's one of the advanced tools, which perhaps very few people will use.
Mhm.
And perhaps one that people might be more likely to use is the beta cell, the advanced markers of beta cell function, so the C peptide and proinsulin. So essentially, as your beta cells fail, so they start to secrete more proinsulin. Basically, the endoplasmic reticulum is sick. It's not able to completely process the insulin molecule, so you start to leak proinsulin into the circulation, and you can measure that. So high proinsulin, sick beta cells, and C-peptide is also obviously a measure of how much insulin you're actually making as opposed to sick insulin, the proinsulin. And so looking at that and the insulin proinsulin ratio can give you insights into beta cell function and helps you understand whether someone's talking about their type 2 diabetes risk being, next week or in a year's time or 5 years' time. And I think there may be some value in that when you're at the
I think one of the values, one of the values of this tool actually making the risk presented as concrete, so that will make it appearing as real for the patients, and that perhaps will make the risk.
I think there's very good evidence about that. If you tell people vaguely, oh, you're at increased risk of heart disease when you're older, it's really not motivating. It sort of almost gives you a sense of hopelessness. Whereas if you actually can present it in really tangible terms, look, if you do nothing, you've got a 15% chance of getting type 2 diabetes in the next 5 years. That's, roll the dice, roll the 6, and that's diabetes. So, then that I think may be more motivating. And the evidence is actually that when you present people with hard numbers like that they can relate to, that it is more motivating to change.
Yeah.
At least I hope so. I mean, that's to be seen in the future. Maybe we need a study to tell us the answer to this.
Yeah, why not? So now the tool is ready to be used, is it?
Yes, I think so. I mean, obviously, there may be possibly some glitches that I haven't spotted. So I think it'll be there for people to use, and so I guess we need a period of bedding in for people to look at it and try it and see what they think of it. But I think if it's useful.
I enjoyed going through it. It's a very nice tool, and thank you very much for devising it and working on it so tirelessly to make it that user-friendly. So I personally found it very useful. Now your turn, guys, at our audience to try it. And your feedback is always welcome. So you can feedback to Prof. Nandu Thalange through the email that you will see down in the on the screen here. And then we'll be happy to find out your experience. Please feel free to share this tool with your friends and colleagues.
Thank you very much indeed.
Thank you very much for being with us, Prof. Nandu. Thank you very much for this insightful and very brilliantly work that you have done. So we'll look forward for new projects.
Always more to come, unfortunately. Yeah,
Thank you
always
very much.
progress to make.